Good afternoon, everyone. I am going to do another data update. I'm going to try to keep this one really focused on the data because I've been seeing some trends in the data. I've been wondering what they mean, and I made a plot and it seemed to show those trends in a way that made sense to me. So I'm going to show you that. And the question for today is, will Florida and Texas follow Arizona's path? 2 weeks ago, this would have been a bad thing to say. Now it's actually a good thing to say if they follow Arizona's path. So let me show you what Arizona's path is and why I am hoping that Florida and Texas may follow it. First of all, the national overview. You can always get these at COVID tracking, and they actually have a really good hospitalization now. Now that Florida has finally gotten its act together and is reporting currently hospitalized, you can see that we have the blue curve is coming up, and it is back up to where it was at the beginning. But I still want to say, I would not call this a second wave. It is a first wave for the southern U.S. It is not a second wave for them. They have not seen this before. It is also much more geographically distributed, and that implies that there will be more healthcare resources to take care of it. So let's see how the numbers break down state by state. Again, state it's a bad proxy, but it's the best proxy that we have for being more local than saying our nation of 330 million people. The other thing I would like to point out, deaths are climbing again, and the question is, how far will they climb? Of course, cases are testing again. Always keep in mind this is in the context of pretty linear increase in testing. We are testing now 800,000 a day, roughly. We're up from 200,000 a day. Testing has quadrupled. New cases have gone up faster than that if you look back to mid-June. They have more than quadrupled. But at the same time, you've got to remember some of this increase is to be expected from doing so many more tests. Now, however, it is going up. The other thing I will point out is I'm hoping that that line will increase less and less as we go on. There's some indications in the past couple weeks it's increasing less than it was a few weeks ago, and that's actually a good sign. But of course, cases are always dependent on how much you test. The other thing we should always look at is hospitalizations and the curve for deaths, and I already talked about those. I just want to mention that the deaths jump up at point B because of a data dump. You've always got to watch out for that with these data. But if you look at the rest of the line there, that's a real increase, and it started about July 4th weekend. That was the low end of the data point. The reason why I want to point that out is because I was told weeks ahead of time that July 4th would probably be the low point before we start to go up again by this model right here, COVID-projections.com. It's the C19 Pro model. Yu Yang is the scientist who heads it up. He's a data scientist of some sort. I actually don't really know. I just know that the data fits with what I've seen from looking at the data myself, and so I trust this one. I've also seen it be trustworthy because, for example, it said July 4th we'd reach a bottom in the death count, and we should increase from there. The other thing is I want to show you what his projections are for the future. And you see that there is a dash line that goes up to about 900 now. That has increased a little bit, but it's also moved forward in time to where it was before. So actually the peak that we're getting projected is actually a little bit sooner and a little bit higher. Overall, the numbers are about the same. It's about 200,000 predicted to die from COVID before October 1. Let's hope that those numbers can go down, but this model has been pretty good so far. I want to look at the uncertainty in the model's projections. You'll notice that the bottom end of the red shaded part is around 500 deaths per day, and the top end is close to 2,000. I'm going a little bit beyond what this projects because I have seen this model sort of edge up a little bit as we move on through. But it's not spiking up, it's just edging up. And so I want to say right now, on my last one I said that the plateau would be about 750 deaths per day. Now it's looking like it'll be more like 850. But as we get closer and closer, that will be more and more nailed down. Let's hope that it can stay down. The indications are the model of if this follows the path that we've seen it take, that at least through the next couple months, it looks like this is what to expect. You can also look at individual states on there. But I'm not going to do that today because the one thing that I don't see on that, I think it's included in the model, but it's just not explicitly shown, is hospitalizations, which is what I think is perhaps the most reliable data point. They have to be diagnosed, they have to be admitted to the hospital, they have to be counted, and it is more complex to do that. With all that said, it is a good indication that the disease is indeed severe and not mild symptoms or asymptomatic. I believe we are catching more of those the more that we test. And so I've done the drop-down plot before. You can actually do your own at this website that I have right here. I just want to remind you, I'm not going to do it for cases or deaths today because you can do it by going there. But I want to do it for the thing you can't do, hospital beds occupied per day. Now, hospital beds is a day-by-day occupation. It's a duration rather than a single irreversible event like testing positive or death. So it is a little bit weirder to apply the drop-down point to it. So I want to say technically I'm applying the drop-down plot to beds occupied per day. And that's reported by most states now. Again, Florida, thank you. And we're going to talk about the strengths of this are that it should be roughly proportional to population is what the capacity should be. I know it's going to go up and down a little bit state by state, but we're talking about a first order of magnitude type approximation. So all we can say is in this plot, the only thing you have to sort of correct for is you have to account for the fact that more populous states will have capacity for more hospitalized patients. And so here is the graph, the hospital graph for, let's see, 7 different states that we're going to talk about right here. Again, I don't include the Northeast states because they would blow the scale out of the water. We've got to be able to see what's going on here. Let's start from the bottom. Let's start with the yellow squares, which is Washington at the very bottom. I want to point out that Washington has about an average population, about 8 million people in the state. And you see how low the hospitalization is. Washington has avoided the burden on the healthcare system. And you see that now it has dropped down. Once more about these drop-down plots. Northeast is bad. South is good. And so you see that Washington has been sort of going southeast, okay? So sort of good-ish. But recently we've had a bit of a bounce. We've been sort of flattish and bouncing around right there. What I want you to do is I want you to think of this drop-down plot as literally being like a ball bouncing. And you can see how high it bounces is how many hospital beds are occupied in that state. Washington is an example of bouncing around at the bottom, not staying down, but not getting very high either. Washington has less than 400 people hospitalized right now. Per capita, that's really good. Okay, I think we have capacity for up to 8,000. So from what I've seen other healthcare systems do. And so that means we have 400 occupied, capacity of about 8,000. That seems to be like we can handle it. Okay? But the other states are the ones, and especially I'm worried about Arizona, only has 7 million people, fewer people than Washington State has. And yet if you go up to the next line up, it's like a little sun with the yellow and orange. And you can see that it was sort of ambling around going east, and then all of a sudden you had the spike that you've no doubt heard about. So I want to show you the nature of the spike, how high it goes relative to Arizona's smaller population as well. But also I want you to see something about this. See how the spike is now tailing off and going, you can't quite see it, but I'll show you in a few. It's actually starting to go down. And so this means that this is why I say Arizona is past the peak. I can show you the rest of the data in another chart for why I think that is in raw hospital data. Arizona has basically been flat in hospitalizations for 2 weeks now. That's a pretty long thing, and I've been sitting on this for a while because I want to be sure. And this is as sure as I'm going to be that for 2 weeks we've been flat. Now you see other things have bounced up, and people are always worried about that happening. But I haven't seen a scale of turnaround relative to population of Arizona going back up from what they were before. So let's watch Arizona and see if it continues to go down. Just today, they had the biggest drop in hospitalizations that they've ever had in Arizona. More than 200 hospitalizations net were freed up by COVID patients leaving. Okay, and most of those patients are recovering. Death rates are actually, according to the Yuyangu model, they're doing roughly what you expect, about in the hundreds a day rather than in the thousands a day, you see. So let's move on through the other ones. Michigan in blue for the football team. You can see that they had an early spike. They had an outbreak in Detroit, and then it dropped down and pretty much stayed down. Although, is that the beginning of a bounce right there? I don't know. We'll have to watch it. But the good news is it's far down where it was before. Louisiana also had an outbreak in New Orleans, but notice that the scale of the outbreak, Louisiana is the smallest state of all, I believe, on this whole chart. And so the fact that they're up there at all was bad news for them. But they did get over the spike, and they started to fall down before now they have a bounce. This is the only case of the couple cases where I'm willing to say, okay, this genuinely looks like what I would call a second wave. Not a first wave, not a delayed first wave. The only thing I will say about Louisiana is I'm hoping that that bounce is still below what it was before. And if you can imagine a little parabola, I can definitely imagine it not bouncing as high as it was before and then coming back down. How many bounces do you get? I don't know. But the one thing I can say is I'm hoping that the second bounce is lower than the first. If that's the case, then we can use Louisiana. Keep your eye on them for what they're going to do. The other ones are the big states that you no doubt have heard of. You've heard of Florida, Texas, and California. By the way, because Florida has only been reporting current hospitalizations for a week, I did sort of a Frankenstein-type move. I took Texas's data and I adapted it to Florida's because I've observed that their hospital admission patterns seem to be relatively similar. So they're about the same size state, and I figure it wouldn't be that far off. So the old Florida data is actually Texas data, but the new Florida data is what we really want to look at. All right, so let's zoom in a little more, and let's look at these other big states relative to California. Now, you see, California never really dropped off. They've always had people in the hospital. And also, recently they have had a uptick and a spike, and you see that it's gone up, but in terms of hospitalizations, you also see that it's not increasing its acceleration. Its acceleration is decreasing. It's still going up, and there are still more people in hospital beds than there were before. But the rate of increase is markedly slower. This is good news for California because, remember, it's the most populous state. It actually has 5 times as many people as Washington does in it, and it has more people than Texas or Florida. So if you look at that and you look at hospital occupancy, California has so many more people that it actually falls farther down on this graph. There is a genuine outbreak going along. It's also a really big state, so I'm sure that southern parts of the state are being hit hard right now. But we've also got to realize it does have capacity and resources in the northern part of the state. It's a huge issue of how you distribute those. It's a huge issue of how you deal with the fact that people are getting overworked and the healthcare system is being overtaxed. But it's not the same scale of problem that was going on in New York City in April. Okay? So I want to zoom in again one more time because I want to look really at Texas, Florida, and Arizona. And I want to show you Arizona zoomed in. You see right there, it's actually definitely going down. And we do have bumps that go up and down. But when you're in the middle of an outbreak, it actually tends to follow a relatively smooth line on this chart. If you go back and look at all these lines, when it's moving in the same direction. There's this sort of outbreak inertia. And that's why I'm so want to show you that it's going down now, because once that inertia turns around, I hope that it will continue. And there are signs that in the other cases, like Louisiana and things like that, once it started to turn around, it will keep on going down, and we won't see a period of exponential growth. This doesn't give you anything about saying exactly what do we need to do to keep this going, other than to keep trying to do the same things that we're doing right now. Okay? But it does suggest what we're doing right now is at least having an impact and making things better. Not good necessarily yet, but better. And some days that's all I can ask for, right? So notice about Texas and Florida. Notice what I said, Texas definitely looks like it's slowing down. Florida is not. And you see that Florida, you might say Florida's below the Texas line, so isn't that okay? Well, actually no. Florida has 21 million people, Texas has 29 million people. So Florida has a significant amount fewer people than Texas does, like 25-30%. And yet their hospitals are just about as full and increasing along this line. So all this is to say, My hope at this point is that Florida can follow Texas's line. If it does, as overloaded as Texas is, Florida is going to end up being proportionately a little more overloaded. And because I personally know people that are overloaded with this right now, this is where I'm saying, whatever you can do to help. I think that we should have some kind of healthcare transfers. I've heard about something about nurses in the system being able to be moved to Florida to help out, because it's not just the physical beds, it's the staff for those beds. It's the doctors and nurses to take care of those people. But the good news is, in the northern states, there should be healthcare capacity right now to be able to try to figure some of these things out as we go through this. And there might be future bounces, but my hope is the future bounces will be smaller than the first, like Yu Yang Gu's model predicts. And like most of the models predict, actually, they mostly predict that the second bounce will be lower than the first. And let's see how low it will be. But first of all, let's hope that these first bounces for Texas, Florida, and Arizona turn around, and California, I hope it turns around too, but they're not proportionately in as bad of a state as the other three states right now. So there are signs for hope. These aren't shooting up at the same rate. Things are accelerating. There's some kind of gravity pulling it down. And if you've seen my other talks, you've seen the things about T cells. What might that gravity be? We don't know exactly how this affects anything. All I've got to say is there's not just badness in the world. There's also things that fight off the viruses. And they have been trained on some things. I'm hoping that those T cells are part of what's pulling these things down. And I'm hoping this trend will continue. So, here's what it says for predictions for the future. This is where I really get nervous because I'm really uncertain. But this is where I've seen enough data to say, okay, I'm going to put my name on the line and I'm going to say, I think this might happen, right? Okay, so Arizona's hospitalizations have been flat for 2 weeks, and I'm hoping they're starting to genuinely drop now. Texas's hospitalizations have been flat for 3 to 4 days. If they follow the same path, maybe a week and a half of flatness, and then they start to go down. Florida, from its slope, you see that they're behind on the curve. I estimate if they follow the same path as the other states, then they're going to increase from 9,000 hospitalized right now to about maybe 12,000. Which is a lot for a state with only 21 million people like Florida. That's roughly an Arizona-like overflow, and is worse than Texas. The good news I can offer is if they follow this path, they will start to flatten out in about 2 weeks. And they will be slowing down before they get to that point. So in a month, hospitalizations would start to drop for Florida. And then no doubt we'd have another outbreak. That's the nature of viral outbreaks. But we've got to compare these outbreaks. Because we've had so many now, we can at least look at them and say, okay, worst case scenario didn't happen there. Best case scenario also didn't happen. But what's in the middle that we see that actually happened? What do we expect? This is what I project based on what we see right now. So for the next week, will Arizona's hospitalizations continue to drop? Will Texas continue to remain flat and then start to go down after a week and a half? Will Florida finally slow down? Like I said, I think it'll take 2 weeks. How big will Louisiana's second bounce be? Will it indeed be smaller than the first? How much smaller? And how much does the previous outbreak affect the later outbreaks? How does the second expansion relate to the first? So Michigan, even Ohio has a little bit of this. And the data's coming in. So that's the point of the data updates. We'll try to get into that. I'm going to add on another little thing where I go through the data where I show you the hospitalizations in real time. But if you're not wanting to see the actual curves for a particular state, then nice to see you virtually this week. And hopefully in about another week I'll come back and I'll see how these predictions are doing. Until then, stay well.